This is a really important sub-analysis of the JUMP study. Now, the JUMP study was this very large phase 3B study of ruxolitinib across risk categories like intermediate 1, intermediate 2, high. A very, very important study because in the COMFORT trials that led to ruxolitinib approval, you only had intermediate 2 and high risk patients and with platelets 100 and higher. Now, in JUMP, you just had a more realistic, if you will, a population with a lot of intermediate 1 patients, platelets 50 and higher. So, very, very important study and very large, 2,233 patients. So, this particular analysis was in a subset of these patients with hemoglobin less than 12 or less than 10. Now, obviously, the less than 10s will be part of the less than 12s, but essentially anemic patients from JUMP who were treated with ruxolitinib. And the focus of this particular abstract was really to look at patients who got an erythroid stimulating agent or danazol as a means to counteract the anemia that ruxolitinib causes. So, just to give our audience a general idea of the numbers, there were about 1,384, something around that, patients that met the anemia parameters, and just about 100 of them received either an ESA or danazol. Now, the takeaway from this, which is really important and reassuring, I think, is that these agents were able to counteract some of that anemia that ruxolitinib causes. The drop really was around 1 gram in hemoglobin and really not much more than that, and then that got corrected. So the nadir happened. These agents did not prevent that from happening, but I think they blunted the nadir that you would otherwise get from just ruxolitinib without the support. So I think they blunted that decrease in hemoglobin, and then there was a nice recovery pretty much back to baseline. So that tells you that we know that anemia is a consequence of ruxolitinib. We know it's going to happen, and we need to know how to counteract it. And this is some nice data, I think, just reinforcing what we already do, which is to support the anemia with agents such as these, and also luspatercept. We have a lot of luspatercept used in the US, even though that's off-label, but we use that to counteract this anemia as well. And importantly, this sort of strategy allows you to maintain dosing of ruxolitinib, which is so critical for its spleen response, and that in turn is connected to survival, is linked to survival. So this study, again, going back to this abstract, they showed that patients were able to maintain a decent dose of ruxolitinib. Now, there was a diminution in the dose, which I think was a consequence of trying to ameliorate the anemia, but at least patients were able to remain on 25 milligrams a day or higher. So I think this is a very useful, practical data set that reinforces our feeling that we need to be able to support the anemia with ruxolitinib and maintain the dose.